Denise Sakuze Skaze, Hadi Sootsen, Travis Holyk, Biskai Satni. Masai lately tene gain no yenta yakluk. I tried my best on that one. That one's new, I just threw that in there. Gaidzin Honzu. And congratulations, Carrier Sekani Family Services, on 30 years. Mbe honesty. Another thing that we were asked to do, and I didn't actually submit it, but I think I'll talk about it now, is submit one of our own experiences over the past 30 years. And I've been with Carrier Sekani for about 18 years now. And I think it was probably in about my first year, so about 17 years ago, 16 years ago, I was invited to Dick Alex Headstone Feast. So the dates might not, I think it was Dick Alex Headstone Feast. And it was one of the first times that I went out to the community by myself. And so I was really apprehensive. And so everyone was kind of standing on the lawn at the house before they dragged the headstone. And I was like really, really nervous, and I could see eyes on me as I pulled up, like, who is this guy who's like now pulled up and is standing here on the lawn with us? And Melianne Adam saw me, and I think she must have known me from other events, but I didn't know her that well yet then. And she walked across the lawn and gave me the biggest hug. And from then on, I thought, okay, like, I belong. I can tell, like, everyone else is like, okay, this guy must belong here. And so it was a very powerful moment. And I just, like, as staff and everyone else, I just want to say thank you for making me feel like I've belonged over all these years. Now on to the slides. So, in addition, thank you to our doctors and everyone who has been able to so quickly switch during such difficult times. So Carrier Sekani has always been a leader in virtual services. And because we were a leader in that area, we were able to switch over to providing doctor services and others quite quickly. And it was the province kind of looking at leaders like Carrier Sekani. I know Dr. John was assisting with Doctors of the Day and other things, getting those set up. And so I'd just like to acknowledge that. And also to our nurses, care aides, MOAs, and all those who continue to provide in-person services using personal protective equipment in spite of risk and uncertainty that followed with COVID. Like, I'm just so proud of you, and I'd like to thank you all for everything that you do. So I have been involved with Northern Health on their EOC committees. So I'd just like to say that there's been extensive planning in reshaping our hospitals and the planning for what we do if there actually was a case. And then at a local level within CSFS, we do have a critical response working group that's developed community plans if there is a COVID case. And so a lot of work has been done by Judith Sanford, contacting all the communities and determining what our plans would look like. We've also had a number of community concerns about exposure to COVID-19, and we're in constant contact with Northern Health Authority around case tracing. And if our communities did have a case, we would be notified. I know in the province, sometimes there has been some concern about the relationship. And I would say within Carrier Sekani, we've worked really hard with our Northern Health partners and with FNHA around communication lines. So again, being leaders around even those partnerships that are developed. In terms of services, we've been following exposure plans that we completed for each health center. And as part of those exposure plans, a lot of work has gone into them with Charlotte Weninger, with Kathy Scott, with Judith, for safe return to the clinic. So safety is our priority. And I would also say, like, as far as screening and other things, it has gone down, and I really encourage people to still be seeing your medical professionals, because, like, although COVID is really scary, if we don't do pre-screening for certain things, like, that can be just as scary and just as harmful. So we've been preparing our clinics with appropriate signage, with physical barriers. We've been removing unnecessary equipment. We've also done teaching and increased cleaning, and we've been screening of patients for COVID-19 symptoms, and we've been wearing personal protective equipment when providing direct patient care. And again, a shout out to Kathy for all the work that she's done for all of our offices. So occupational health and safety work that she's done. She's our accreditation leave, but she quickly switched to make sure that everyone felt safe. And I saw Kathy outside and she said, "Did you put something in there about me in your presentation?" And so there you go, Kathy. I will also say that our UBA clinic in Prince George is still providing in-person visits with safety precautions in place. Our nurses and care aides and physiotherapy are still doing work in the communities wearing PPE. And we've also, another important piece, will be working for the uptake in flu vaccines this year, as having flu and COVID-19 increases risks for individuals. So Judith will be starting a COVID-19 campaign. Another thing that we've done this year is implemented an integrated care team in Burns Lake and with Suatin First Nation. So that's in addition to teams already in place in Takala, Sycas, Yakuche, Southside, and PG. And you may say, what are integrated teams? So basically it's based on the Carrier Sekani premise of holistic care. So we always talked about we need to provide holistic care, and this really puts that into action. So it creates teams of service providers that meet on a monthly basis to discuss patients who may need additional planning in order to wrap services fully around those individuals. So it's always done with the consent of the patient, and confidentiality among providers is critical and one of our major priorities. As far as visits this year, in spite of COVID, our numbers are actually very similar to years gone by, and part of that is due to an increase in staff. So we actually had 1,000 more physician clinical visits this year over last year, and that's in-person clinical visits. While some of our other visits, so online, those numbers remained relatively the same in spite of COVID. The other thing that I should mention, and in the picture in the top there, we have a new program at CSFS, which is physiotherapy, that we're trying to grow. And so Bonnie is pictured in the picture. She's a physiotherapist based in Burns Lake. And so the work that she's doing is largely based on the work that Robin Roots has been doing, and so demonstrated need for physiotherapy, particularly around pain management. When we talk about our opioid use strategy and other things, if you don't have other services like physiotherapy to manage people's pain, then it's pretty tough to have an opioid strategy. And so Robin, now there is a program at UNBC around physiotherapists, and so she hasn't been coming to the community as often, so we're really thankful that Bonnie's been able to carry that torch and continue those services. Jacob was also added to our team, and he's working on establishing those integrated care teams. But by training, he's also a social worker, so he's also fulfilling a social work role at the UBA clinic. And so we're thankful that we're actually adding a team around our nurse practitioners in Prince George. And Eloisa has focused on chronic disease, and she may actually start as a nurse. She has been doing some work in Sycas and may actually move to that role. But we've been thankful to have her, particularly with COVID, because she has been following up with a lot of those chronic disease patients and making sure that those that are shut in are still receiving access to care. The announcement that's been alluded to a few times is the Foundry Center that we will be developing for the Burns Lake area. So Foundry is a provincial initiative with the goal of removing barriers for young people to access care. And there's currently 9 centers in British Columbia, 2 of which in the north. So one of the first sites was Prince George, and Terrace is just slowly starting to start up now. I think they don't have their permanent site yet, but have been providing some services in the Terrace area. And so what Foundry is all about, it's really reflective of the Carrier Sekani model of care, because it's much like I talked about with integration. It provides mental health, primary care, substance use, social services, youth and family peer support, all in one place. And so that's very similar to what Carrier Sekani wanted to do. So it was actually Burns Lake Band that said, hey, are you going to apply for this? And we thought, yeah, it totally matches our mandate. It's something that we should do. And so we're proud to announce that we're one of 8 new centers. There were 40 communities throughout British Columbia that applied, and we were successful. The 8 new locations were chosen after an extensive selection process that included letters of intent, proposals, interviews with independent panels made up of subject experts, so youth and family advisors, where we had interviews that both our executive, or our CEO and were part of. And then also we went down there and had additional meetings. So it was quite an extensive process. So where we are right now is we've developed a project charter. We're in the process of completing our work plan. We've developed a terms of reference for leadership tables. So the Foundry model is also premised on making sure that those in the community are part of how that service is delivered. And I should mention that this service is for all individuals in the Burns Lake area. So it will be Carrier Sekani as the lead agency in partnership with Foundry, providing services to all in the Burns Lake area. Currently, we're looking at locations. And so one of the locations we're looking at is the old courthouse. And we're probably about 18 months away from opening. And Robert also mentioned that one of the other things we try to do in our department is find innovative ways to provide healthcare. And so crazy times in February, we had our hockey tournament, and I refereed at the hockey tournament, and straight from there on Sunday flew to Vancouver to actually have the Foundry meetings. And who would have thought that that would be kind of the last time that you felt safe being on an airplane or being at a group gathering like that? So just from February to now. But we do try to find ways, like we did Hep C screening and other things at that event, try to find ways to provide care in fun and exciting ways and get the word out, much like our communications department is doing a good job of doing. The other thing that I oversee, and that has been one of Carrier Sekani Family Services' strengths, is our research department. And one of the big projects that we have on the go right now is called Strength for All. And it builds on the youth suicide project that Mary talked about, that really was kind of the guiding light around some of the culture camps and things that we have done since. And then we got feedback that, well, you need to focus on all age groups. So we did do a project around 25 to 40-year-olds. And then we thought, well, elders are also a group that we should provide services for. So in terms of getting some information from the elders, we brought in an advisory group asking them what they would like to see. And so the graphic that you can see on the screen is some of that information around services that they wanted provided. And so they said, let's make sure that it is land-based and connected to culture, connected to youth, connected to others. And so that is what we started to do, and then COVID hit. So you can see there that we have been having gatherings with our elders, doing home visits, storytelling, luncheons. We did DAC Health Pictionary. Bianca went and did tea and bannock and snacks and other traditional activities. We hosted a Batlats in Yakuche, and the feedback that I received from that was that the elders thought it was just going to be another teaching potlatch, but it was them that took it on, and they were like, wow, this is fantastic. This is exactly how we do it. We were like, yeah, that's because you took it on and did it. Very good. And so the other thing, like Bianca's been amazing. On one of her trips, she saw that somebody had shot a moose. So she texted me and said, is it okay if I help them carry this out of the bush? And so I think like we're definitely doing research in a different way, and I applaud Bianca for being part of that team and really getting her hands dirty with the projects that we are doing. Another major project that we have been working on is focused on lung health with the objectives of estimating the prevalence of COPD, chronic obstructive pulmonary disease. The other thing that when we did work with our research advisory team was that they said, we also want to see like not just that testing, but what is it that potentially is making us sick? So we also are trying to understand the relationship between pollutants and symptoms. So we've been doing home visits where we actually screen for those indoor pollutants as well as inspect for mold and other things. And that was largely driven by our advisory committee. And then we provide a questionnaire that BENA does that links results to health history. And so I just threw in there as well that one of the big things that we do is spirometry, which is a test to help a doctor diagnose chronic lung problems. We bring that right to the community and do that testing in the community. Because of COVID, and obviously because the idea now is that it's airborne, we won't be doing it this September and kind of into the fall, which was the time that we generally were doing this project. We did that partly because of with houses, you want it to test the air quality when they're sealed or when people have their furnaces or their wood stoves going to actually be able to test carbon monoxide, carbon dioxide. But we just feel like with research, like our major principle is do no harm, and we just think the benefits of going to the community right now don't outweigh like the safety of people as far as COVID. But I will share like some of the information with you. So as far as the number of participants to date, we've had 157 people. One of the interesting stats that you can see there is that 74% have current or past tobacco use. So that, again, as far as like screening that we have in MOAS, that's something that we'll be sharing with our doctors to help screen and ask people about their smoking habits. Another one that people talked about was their exposure to dust and other things in work environments. So almost half of people have had that. And then our numbers are actually, as our population goes up, of the ones we're tested, are coming more in line with the general population, which is about 10%, 11% of people experience a prevalence of COPD. We're at 15%. And then another project that we've been working on is around women's health. And Warner has really been pressing upon us the need for cancer research, and this is one of our first projects related to that. So during a Pap test, a doctor collects a sample of cells from the cervix and sends those cells to a lab to be observed under a microscope, and it will show if there's changes in the cervix cells that may look like pre-cervical cancer or cervical cancer. And so obviously, cervical cancer is the most common cancer caused by human papillomavirus, or HPV. And with HPV, there's over 100 types, and some of these are low risk, and some of these are high risk. What we've done, based on some of the feedback that we've received around some people not being comfortable with a Pap test, have been working with Dr. Shiona Mitchell-Foster around doing self-screening. And another reason for me that this is important, particularly in times of COVID, the one slide that I did put there is Pap test volume by week. And you can see that this is provincial, but during COVID, that the numbers just dove. And so like early detection is always key. And so what this project actually does is a person collects a sample from their own vagina using a soft brush or swab. That sample is then mailed to a laboratory and is tested for the types of HPV that can cause cervical cancer. So to date, we've had 43 participants. in this project, and we work closely with our primary care providers. And if individuals don't have one of our providers as one of theirs, we send those results to their primary care practitioner. So I use the word primary care. That would usually be someone's doctor or nurse practitioner, the place where they normally go for their care. So of those tests, 34 have been HPV negative. And I mentioned those different types of HPV. One of the tests has been HPV high risk positive, and another is HPV other high risk positive. And then 2 of our tests, sometimes, like if it's not swabbed correctly, will result in no result in the sample. So again, this is available in your communities. You can talk to your community health nurse, and we can make that test available for you. The other thing, this was supposed to be a short-term project, but one of the things that we have been able to do is actually continue it until 2022. And we've been impressing upon those that we don't necessarily like projects. We want it to be continuing. So a second proposal was written in order for us to get to 2022. And we're hoping through the results and through the results of a survey that we are doing of those who have participated, that we can make this a regular part of screening care that's available for our communities going forward. So during that time frame, we hope to recruit an additional 40 to 50 additional participants and continue community engagement. So a big part of this has been going to the communities and asking them how they'd like to proceed. And again, with this, it's for those who haven't had a PAP test previously. So we're trying to get to those who, through historical trauma or other things, are concerned about going to their doctor for such a test. Another project that is now a program at Carrier Sekani that started because of some of the research that we do is our intensive family therapeutic services, which delivers in-home counseling and crisis intervention aimed at preventing children from entering into foster care. So when we did that initial research, Mary, you'll remember that the biggest thing that people said is we're tired of our children being removed. And so we thought we need an immediate response to doing that. So we've started this project, or program, I keep saying project for some reason, excuse me, but this program in Prince George. We now have attempted to bring it to the communities of Vanderhoof and Burns Lake. The first times we've posted for clinicians for those communities, we've been unsuccessful. I know there's a lot of work going on in the communities, but it'll be something that we definitely will work towards having these at a community level as well. So it's services that are typically 28 days in duration, and the clinician is available for support 24 hours a day, 7 days a week, providing those services. Currently, due to COVID, a lot of those services have also gone virtual, but where appropriate and where best meeting the needs, they still do meet outdoors and other places. And it's one of the programs that we are proud of because of our numbers. So we've worked with 249 children, we've worked with over 270 children now, and 249 of those children have remained with their parents, and 9 have remained with their family, and only 29 have been removed. So there's been huge success in this program. And finally, as far as programs that I was going to talk about today, oh, actually, I will add, one of the other things with this program is I'll go back, is those who are in immediate risk of entering care. And so we now have set up a perinatal clinician position out of our UBA clinic because we want to reach those, it's before MCFD says we're going to remove. So what Jennifer will be doing is improving access to healthcare and social services. She was part of our intensive family therapeutic services and has moved over to this position. So those who have alcohol or drug dependency, she'll be supporting those individuals. And basically it'll also support transition from hospital to community services. And the final project that I'll talk about is collaborative practices. And so this is, you'll hear a lot about carrier decision-making. So families taking responsibility for themselves in making plans for their family, and that's what they try to do. So we use various models to meet the needs of the family, from family group conferences, where that's a large meeting, takes a lot of work to bring everyone together and all family that individuals identify. We did 42 of those this year. Now, interestingly, when we first started, our numbers were small. Our team has remained the same, and they've been able to do more work each year, adding different case conferences to meet the needs of our staff without really the staff increasing. So I'm really proud of this team. So other services that we do provide, family case planning conferences is a 2-hour meeting, kind of when MCFD becomes involved and you need kind of a quick get everyone together and make a plan. They do that work. We also work with youth who are transitioning out of care. We've provided 9 of those services. And then just a general prevention meeting. So anyone can refer to these services, and we want to make sure that children don't enter into care. With that, I will leave it for questions. Masai Chos Nachalya.
All right, so I'll ask if anyone in the room has any questions for Dr. Biscay. Oh.
I did get a haircut for the first time in a long while. But before that, it was actually my haircut was my let's go to the Foundry meeting and look presentable haircut.
So we have a question. What can be done to increase the use of the youth transition planning?
What can be done? So, yeah, I think just getting the word out that that is available. So, yeah, as a child and family services team, that's a service that is available to you. To youth, if you're having issues with your parents, even at home, it's something that we can provide support that way. In working with families, again, like our main goal is always keeping children out of care and creating harmony in families. So if youth are having troubles with their parents, I know when we were working with youth around developing the Foundry Center, one of the big things that they said about wanting a Foundry Center was, well, I just need that 2 hours somewhere to go before I go home just to kind of decompress and brace myself. So we know youth are going through a lot. And so, yeah, absolutely, we can support youth through these services.
All right, thank you.
All right, Masai.